So we do some anticoagulation. I think this is also very important to have some idea. The one I'm going to talk about is Coumadin, okay, or Warfarin, whatever they give you, just take, they are the same. This is anticoagulation. What does that mean? Preventing clot formation. That is all based on the name. If I'm preventing clot formation, I need to block things that causes coagulation. That's how it makes sense. I'm blocking things that causes coagulation. Where Coumadin said I'm attacking factor 2, factor 7, factor 9, and factor 10, and protein C and H. So that's how it does this thing. It block all these guys, and they don't do their function. These are what we call vitamin K dependent factors. And then they are made in the liver. Okay, so that's what, when you take Coumadin, this is what happens. It basically affects this thing, and then they lead to your blood not to clot. These factors control your PT and INR. Factor 2, 7, 9, 10, C, they control PT, INR. Therefore, if you're taking Coumadin that is blocking this, is blocking them. Okay, Coumadin said, I'm blocking you here. Therefore, your INR and PTT need to go up. That's the way it has to be, right? And so your normal INR is 1. If you take Coumadin, it goes up by 2 and 3. Okay, and then normal PT, okay, your PT level is 10 or 11 to 12.5. Right, so when you're taking Coumadin, unfortunately, you got to multiply the lower portion by 1.5 to 2, which is equal to, so 11 times 1.5 is 16.5. And then the 12.5 times 2 is 25. So this is the range. That's the range of MPTT. So INR should be 2.3 and PT should be 16.5 to 25. So when you're taking Coumadin, this is where we want to get you to. This is therapeutic because we don't want to clot. The only way we can prevent you from clotting is to get you to this level. We want you to get you to this level, this and that. If your level is low, we got to do something so that we can prevent your level from getting low. So we got to do something about it to help with that. Unfortunately, if you have a heart valve disease, so heart valve, we want a higher level. So instead of doing 2 to 3, this become 2.5 and 3.5. You increase it by this and half, because they have a valve that can break, that can form a clot easily. So 2.5 and 3.5. This is when you have heart valve. Okay, so 2.5 and 3.5. So a patient who had a heart valve, mechanical heart valve, just know it's mechanical heart valve, and their INR is lower than 2.5. You got to do something about it, otherwise they will form a clot. And so it's not good. Teaching. What they're going to ask you is teaching. Okay, teaching is mostly bleeding complication. You want to prevent bleeding as much as possible. And what that means, okay, to prevent, make sure there's no rags on the floor, okay? There's no scattered rags. Otherwise, they'll fall, and then they will bleed in their head. If they're shaving, they should use clippers, no razor blades. This will cut them, and they will bleed for a long time. If they see black tarry stool, call your doctor. This is not normal. ACP notified. Okay. If Coumadin, especially, they should. This is the key, and I don't know what to say. It's very, very important. Okay, avoid. They should not increase or change amount of vitamin K they're eating. The patient will be confused. They say, "Oh, if I'm blocking your vitamin K, then I should have more vitamin K." No, increase or change amount of vitamin K. No, stay there. Stay there. Okay. If you taking 12 grams a day, I want you to take 12 grams a day, because then if you're bleeding, I know that it's the Coumadin that is causing the effect. It's not you having a lot of vitamin K. So don't change the amount of vitamin K you eating. Stay the same range. Don't increase it. Don't lower it. Do the same thing every day. Okay. Bleeding risks, yes. NSAID, avoid it. I want you to take Tylenol or acetaminophen. If you have pain, don't take anything. Don't take anything that will make you bleed. Okay. Don't take any other medication that will make you bleed. It's not good. And avoid the G's, the herbal medication. You know them. The garlic, okay, the ginger, the ginkgo, and the ginseng. All the G's. Avoid it, the 4 G's, okay? They should have alert bracelets. Why? So that when you fall, we know that, oh, you take Coumadin. We know that we scan your head and you don't have headaches and brain injury. Okay, they should avoid it. Then, so this is all for bleeding. Okay, these are all bleeding teaching. You teach them carefully. The vitamin K dependent factors that they will eat, you tell them is that kale, broccoli, okay, spinach, cabbage. It's very, very important. And green leafy vegetables, maybe some liver. Tell them to take the same amount. Don't increase it. Once again, I need to put red arrow there so that it's sinking. Okay, stay the same. Stay the same. Okay, stay same. Don't go up on it. Otherwise, this is where they will trick you. Stay the same. Don't go up on any of your vitamin K. If you're taking this, you take them, but don't go up. And don't choose an answer that says stop it. Don't choose an answer that says stop it, decrease it. No, they shouldn't do that. I think I've drilled this in your head. The other thing too is Coumadin is a teratogen. Therefore, if it's a female, tell them to use other birth control. So like a barrier method, they can have to use condom. Otherwise, the baby will be defected. It's not good. Okay. And it's breaking down by the liver. So any medication that affects liver, sometimes you got to be careful. And I think that is the key thing about it. And I told you about, I'll clean this. It's getting crowded here. I told you about grape juice, right? Yeah, Coumadin. No grape juice. No cranberry juice. Okay. and no green tea. Green tea has a lot of herbal stuff in it, and that will affect your liver, and then that will increase your bleeding. Cranberry juice is not good. Grape juice is also not good. Okay, they should avoid it. His friend that they're going to confuse you with, what do you think? It's heparin. I think heparin is nice. Heparin. Heparin is his friend that who also is an anticoagulation, but it does different things. What does he do? He blocks indirectly factor 10. And that's how it does its effect. Therefore, it doesn't affect your PT, it affects PTT. Okay, it affects your PTT. Your normal PTT, so PTT normal is 25 to 35. And when you, as we multiply the Coumadin, remember the Coumadin, the PT, we multiply 1.5 and 2. That's what you use, 1.5 and 2. Then if therapeutic, we have to multiply 1.5 to 2, which is equal to what? 46 to 70. So your PTT when you're taking heparin is that. Remember, heparin is IV only or sub-Q. There's no oral, no PO. Okay? If you're taking sub-Q, no need for PTT. You don't need for, this is used for prophylaxis to prevent DVT. It's not used to actually do the complete anticoagulation. So this is the normal range, multiply 1.5 to 2, you get this, and that's what you do. Okay, it's usually titrated. So the patient is on it, you titrate, and then you keep on checking normal values. Its half-life is 90 minutes. So it's very quick. It's very, very quick. So you can, when you check the level and it's too high, you stop it and everything will normalize right away. So that's why you titrate it. And then it's very good. They like asking questions about it. If the level is too high, you give them 1 gram of protamine. That's the antidote. Just give it to them and that will prevent excessive bleeding. So I'm talking about somebody PTT is like 200 or 150 and he's bleeding everywhere. Your first choice is protamine. Stop the medication and then give them protamine, 1 gram. Heparin is very notorious. It affects platelet functions. When you start the heparin, there's 2 things that can happen. Day 1. So there's day 1, platelet goes down, but then normalize by day 3. Okay, if platelets go down by day 4, still going down by day 4 days, that's your mark, and it's 50% down. This is what we call heparin-induced thrombocytopenia. So heparin-induced thrombocytopenia. You've dropped their platelet, the platelet will be less than 150,000. And so you have to do something. That's a B-sharp moment. They're going to form a clot. They're going to bleed, hemorrhage. But number 1 thing is thrombosis. People get confused. Thrombosis more than hemorrhage. It's mostly not bleeding. It's because they're going to form clots. They form clot, you have because of the low platelets, they get a PE. PE, they become a breathing problem. That's B-sharp. So pulmonary embolism and DVT. You see how it come back to B-sharp. Heparin-induced thrombocytopenia, form clot. They have DVT, PE, and a breathing problem. That's B-sharp moment. You need to do something about it. How do you treat this? Treatment. You got to stop the medication. Stop medication right away. Stop medication, the heparin drip. Stop all IV impregnated heparin. Most IV tubings have heparin in it, so you got to stop all of them completely. Stop all IV impregnated heparin as soon as possible. Okay, and you of course you got to check labs. Okay, check labs, and make sure the patient is okay. When you stop all medication, okay, of course you can't stop it on your own. Yeah, I got to say it. You need order. Okay, you just need this one. You need orders to stop the med, but just notify the doctor that the platelet has dropped too much. I don't like the platelet. You have to notify them about the decrease in platelet level. Okay, then you're not done. Patients still need anticoagulation. Okay, you need anticoagulation. You got to stop Lovenox. This is what we call, it's a lower molecular heparin. It's the same thing as Enoxaparin. It's lower molecular weight heparin. It's also heparin, so don't be tricked by it. They will put this one there, then put the patient on Enoxaparin. No, this is a question you should not let them examiner take it away from you. You know this, so you know you've identified that is heparin-induced thrombocytopenia, and probably in the SATA form, you get all these right. Then they'll put the continue and start the patient on Enoxaparin. No, Enoxaparin is a lower molecular heparin. It still has heparin in it. Patient cannot get this. You can put the patient on Warfarin or Coumadin, or the other groups. I call them the Tobans. Example is the Agatobans or the Zabans. You see, they have the last name as Zabans. They will give you a list. If you have Zabans as a last name, I'm choosing it. Or Trobans, Agatobans, you have to choose it. These are the other medications you can choose for the problem. For this patient, because they can have thrombosis, stroke, and DVT, you got to check neurovascular exam. So neurovascular, check their neurovascular exams. Okay, and of course, you got to check their vital. Remember, this guy is on heparin and he's bleeding. You will have thrombosis. We got to do something about it. Okay, the other group I told you, the bigatrons and the rivaroxabans. Okay, these are the factor 10 inhibitors. They take it by mouth. You don't need anything too much to know about it. Just know that they exist. If they give you an anticoagulation, they tell you it's an anticoagulation. They don't give you it's a heparin or Coumadin. It may be one of this, and it's the same thing. Don't worry about it. It will do the same thing. It will cause anticoagulation. The precautions is the same. It's bleeding precautions. Okay, bleeding issue. Your teaching is the same as the heparin. The trick they will get you is this one and heparin. I forgot heparin and these guys and the Tobans or Zabans. The trick they will ask you is no diet restriction or modification. So if they say, oh, I will decrease my leafy vegetables, or I will stop eating vitamin K dependent vegetables. No, you cannot change anything. They don't control that. I will stop eating Spanish. You don't need to. Broccoli, no. Heparin and Zabans, no diet problem. You don't need to change anything. You don't need to even talk about diet. Coumadin, yeah, you talk about diet, but you tell them to stay there. Those are key concepts they can ask you to trick you about it. Okay. For the low bonus, which is Enoxaparin, okay, Enoxaparin. This is a giving sub-Q, so it's giving into your abdomen, about 2 centimeters from the umbilicus. And fundamentals, they will let you have to know this. 45 degrees if they are skinny, okay. 90 degrees if they a little bit have a lot of body fat, and you can pinch at least 2 centimeters. If you can pinch the abdominal wall 2 centimeters, yeah, you give it 90 degrees. And if they're skinny, 45 degrees. You inject it like you inject sub-Q medication, and you don't aspirate. Okay, no aspiration or massage. The same thing. This is a fundamental style you should know by now already, and no massage, nothing like that. It's better to rotate side. If they tell you there's a bruises, it's okay. That's normal. It's no bleeding. That's not B sharp moment. I always say B sharp. So that's my trademark. No B sharp moment. Okay. So that's the anticoagulation